Welcome back to Good Day 712 right now. It is fall. We are in the thick of fall. I know it doesn't feel like it. I know this weekend felt like, what, the end of August? But it is fall. And you may have noticed people getting sick. I mean, that's kind of the time of the year that it is right now. If you have kids, it's always that time of the year. So we want to know what is going around, something we're doing every Monday here on Good Day Colorado. Pediatrician Dr. Kristin Woodward is here to help answer some of these questions. And you know, I mean, this time of the year, we see things like flu and cold. Is there anything unique going around right now that you guys are seeing more of?
Well, right now we're seeing a lot of kids come in with really bad sore throats, but they're testing strep negative. So when they test strep positive, we can offer antibiotics to help treat the infection. But when they're strep negative, we just have to say, well, we recommend over-the-counter pain medication. What you can do is you can alternate Tylenol and ibuprofen, so at least there's something in their system to help with that pain.
All right, and croup, that's increasing right now?
Croup is right now in the fall. It's caused by something called parainfluenza virus, and what it does is it causes swelling of the upper airway, and they get that characteristic bark-like cough and sometimes an inspiratory wheezing sound. And it's really important, if you're worried at all about your child during the day, the croup always gets worse at night because as steroid levels fall in the body. So make sure you go in and see your pediatrician. They might need a breathing treatment or sometimes some steroid.
If it sounds like there's a seal in your house,
exactly,
your kid might have croup.
Exactly.
I mean, I know it's silly, but that's what it sounds like. And if you've been there as a parent, you know exactly what I'm talking about.
You can use a humidifier, which can be helpful as well at home.
That just kind of moistens everything inside.
Exactly.
Okay, and what else we got going on?
So some kids are coming in with nausea, vomiting, and low-grade fevers. And that's a big concern because kids can get dehydrated.
For sure.
So you want to push fluids, but you want to push small volumes.
Okay.
So we're talking several sips every couple of minutes. You know, if you're worried about dehydration, signs are lower energy, sometimes sunken eyes, they're not urinating as frequently. Always go in and see your pediatrician.
And sometimes the hard thing is when they're sick, whatever you put in is just coming back out, and you can't get it to stay in them. Do you suggest things like Pedialyte and maybe even the Gatorade?
I think if they have diarrhea, that's a very good option. Or you can also mix juice half and half with water, and that can cut that sugar level down, which is helpful. And
it's been a warm fall, as I mentioned. Are we still seeing the allergies like you normally would see around fall time?
Absolutely. Yeah. I mean, especially in my house, everybody is, and I know at other people's homes as well. So warm, it's the ragweed that causes all the symptoms in the fall. Another trigger at this time of year is hay. The hay rides, that's a problem for kids. So you want to do all those things that we recommend in the spring. So you want to keep your windows shut, take your allergy medication at night because those pollen counts are highest in the early morning, and try to exercise indoors.
Awesome. Dr. Kristin Woodward, always a pleasure.
Good to see you.
A wealth of information, and we always wonder what's going around, so we appreciate your insight to that. And there you go, Jen. Now you know if you've got runny nose, red eyes, that's why.